Hey there, Ryan Reynolds here. It's a new year, and you know what that means. No, not the diet. Resolutions. A way for us all to try and do a little bit better than we did last year. And my resolution, unlike big wireless, is to not be a raging and raise the price of wireless on you every chance I get. Give it a try at mintmobile.com/switch.
$45 upfront payment required, equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes on unlimited. See mintmobile.com for details.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. Hello, everyone. We have a really cool guest today talking about a very up-and-coming topic in dentistry, AI. So, Dr. Dolan, could you just introduce yourself a bit and tell us about your background in dentistry and then how you got to your current role?
Absolutely. So it's a pleasure to be here. My name is Terri Dolan, and I serve as the Chief Clinical Officer for a dental AI company called Overjet. And I've been doing this for about 2.5 years. Previously, I worked as Chief Clinical Officer for Dentsply Sirona, so I've been in the dental industry for about 10 years. And then prior to that, and don't add up all the years, but prior to that, I worked in dental education and academics, was professor and dean at the University of Florida College of Dentistry.
And what kind of led you to get involved with Overjet?
I guess my main motivation is always about how can we improve people's health? And so, of course, a lot of that is not technology driven, but there's a lot of ways that technology really can help clinicians and patients achieve a better state of health. And so when I think about Overjet and some of my original introduction to the potential for AI to do that, I thought this is really amazing. The technology really overcomes some challenging problems in dentistry, like consistency and accuracy and precision in dental diagnoses. And what if we could use this technology in a way that really could help us provide better care for patients and help patients understand their dental conditions a little more so that they can understand and then accept care and appreciate why it's important to their overall health and well-being. And so Overjet really helps do all those things.
Did you get involved in Overjet kind of at its startup, or was it later on once the idea and product was already put together?
So that's a really great question. And I would say I'm not a founder or an originator, but I did have the great opportunity to meet our founder and CEO, Dr. Warda Inam, when I was attending a conference at Harvard. Harvard School of Dental Medicine had an initiative to better integrate oral health and medicine. And in the context of that meeting, Dr. Warda Inam was one of the presenters. And this was this was probably back in 2017, 2018. And it was my first real, maybe introduction to AI and its potential to improve care delivery or its uses of the technology in dentistry. And when I listened to her presentation, I was just so impressed, one, by her, and two, by this opportunity. And so that was my first introduction to Overjet. I was working with Dentsply Sirona at the time. And then when the opportunity presented itself for me to work at Overjet, I thought, wow, this is really interesting. And then took it from there. But it was really a series of fortunate events that brought me to Overjet.
Can you tell us a little bit about how Overjet works just at a higher level, and then maybe some of the features that practices are using it for?
Well, we should think about Overjet, say, as a technology platform, which means it, fundamentally it takes unstructured data, as part of the dental care process. We collect data about patients, about their health conditions, about chart notes, about radiographs. All of those are pieces of data that can then be aggregated in a way that can either help the clinician in their diagnostic processes or in the provision of care, or maybe at a higher level, keep track of patients. Who's due for a recall visit, who has who has indicators of having periodontal disease, but maybe hasn't been diagnosed or treated yet. So if we think about Overjet as a platform, it really helps us automate some of the day-to-day activities we do in clinical practice. There's an important component to that called computer vision, where we use machine learning and augmented and artificial intelligence to take diagnostic images, dental x-rays, and understand clinical findings in those x-rays, not to replace the clinical exam or the dentist, but to really augment their ability and ensure precision and accuracy. And so there's many, many ways that an AI-enabled platform can assist in clinical dentistry. And we've started, of course, in this computer AI, computer vision dental diagnostic support approach, but I'd say there's a lot more capabilities that will continue to emerge over time.
Do you have a favorite feature or application that people use Overjet to do?
Yeah, well, I have quite a few actually, but maybe one of the things that's I think most beneficial clinically is the fact that when we highlight in colors dental clinical findings on dental x-rays, and you can imagine, think of yourself as a patient in the dental chair, and the clinical team shows you black and white x-rays, and they point out maybe indicators of dental decay or gum disease, periodontal disease. And, and the dentist and the dental team are trying to explain that to the patient, and the patient politely nods and tries to to follow the narrative. But it's just so much easier to explain those clinical conditions when they're highlighted in color, when they're, when the size of a dental decay, carious lesion is identified, and it's easy to point out, where it is located in the enamel or the dentin or close to the pulp of the tooth. Just having all of those colorized features for common clinical conditions, whether it's caries, alveolar bone levels, maybe some periapical pathology, calculus present, it just brings that to life and helps patients really understand that dialogue, and then it makes it easier for them to make a treatment decision, understand why that's important to them. And I think that's probably one of my favorite features, just enabling and supporting patient communication, and which of course leads to case acceptance, treatment acceptance, and patient satisfaction.
How does Overjet integrate into the treatment presentation process? Do you have to open up a separate software? Does it go into your software as like if you used EagleSoft or Dentrix or something? How does that look from a user aspect?
So the Overjet platform does pull data from the practice management system. It's integrated with that. It's when it pulls images from the imaging system, data from the practice management system, puts it in a really nice, easy to use user interface where it displays the radiographs, identifies in color those common clinical findings, has a sidebar that talks about size of lesions, the indicators of periodontal disease, if there's periapical pathology present. So it puts all of that in a very nice user-friendly portal that's easy for the clinician to quickly identify those findings so that things don't get missed, never intentionally, but sometimes in a busy practice, things get missed. And it also makes it easy for the patient to visualize those. There's also toolbars that enable, say, image enhancement, things that make it easier to visualize the x-rays. In addition to that user platform, there's all of these cards that aggregate data in a way that organizes the information in a way that you can easily prepare for your morning huddle. Which patients are coming in, for each patient, what clinical condition you should be on the lookout for. Just pay close attention to, the patients coming in, but they haven't had bite wings recently, for example. So it just flags those indicators that makes it easier to plan your day and make sure that your care is delivered efficiently and that you don't miss things. So I'd say it's a very nicely packaged user interface that connects and pulls data from both their imaging system and your practice management system.
How widespread is Overjet these days? How many practices in general would you say are using it?
Yeah, so that's a great question. It's amazing to me that sometimes technologies just don't take off. And this is probably the most amazing exception to that. Since our launch, which wasn't that long ago, we're in more than 2,500 practices. We also work with many large and mid-size and small dental support organizations, group practices, for lots of reasons. But I think they see the value for both patient communication, for treatment efficiency, and also to help calibrate and do quality reviews for the care that's delivered. Whether it's an individual practice, a small, medium, or large group practice, there's lots of really important uses of the platform and the technology to really improve care delivery.
And I don't know if this would apply to Overjet specifically, but maybe AI in general. Do you know if insurance companies are utilizing AI when they're reviewing claims to determine if they're going to approve or deny?
Yep. And I'd say that is a really interesting and important use case. And I'm glad that you asked about that. So in addition to us working with clinicians and practices, we also work with most of the major insurance companies. And in fact, they, in the aggregate, cover about 110 million lives. So that's a pretty good adoption by the insurance company. And why would an insurance company be interested in this technology? If you think about the processes used by insurance company, a lot of it is repetitive processes. They were very ripe for automation, I would say. That a lot of the prior practices were inefficient. A lot of it was by paper or just wasn't organized in a way that took advantage of AI technology to make those processes more efficient. And another value clinically is that just like the same technology is used to identify common clinical findings for the clinician on the radiographs, those same radiographs can be sent to the insurance company with those markings or those annotations as well. And then you get to have kind of using what I'd say a common ruler. If we use the same common clinical criteria and we know what's expected for submissions for each CDT code, for example, the clinician and the clinical team know what needs to be submitted, and the insurance companies expect that, and then they can use the technology to very quickly and easily and efficiently review that submitted claim. Then it really becomes a win-win. It's that common measurement, common ruler. It's more efficient, automated, efficient processing of claims, faster review times, and quicker payment to the clinician or the patient. And so I would say that there's lots of opportunity for a win-win. And it's pretty unique perspective that Overjet has the opportunity to work with both the payers and the clinicians to take advantage of technology to make it a win-win for both parties. But not to forget the patient, of course, who, nobody wants the back and forth and conversations about missing data, for example, that slows down the claims review process.
Oh, it's such a clutch off-season pickup, Dave.
I was worried we'd bring back the same team.
I meant those blackout motorized shades.
Blinds.com made it crazy affordable to replace our old blinds.
Hard to install?
No, it's easy. I installed these and then got some for my mom. She talked to a design consultant for free and scheduled a professional measure and install.
Hall of Fame son.
They're the #1 online retailer of custom window coverings in the world.
Blinds.com is the GOAT.
Shop Blinds.com right now and get up to 45% off select styles. Rules and restrictions may apply.
And another sector I feel like AI could be so helpful is dental education when it comes to the dental schools. Is Overjet involved in assisting student learning?
So now you're getting to one of my favorite parts of my job, because as you know, I was previously worked at the University of Florida for many years, and I really see the opportunity for this technology to both help students better, more effectively learn better, and really, it's just like we have patients have trouble seeing findings on 2D black and white images. Dental students have the same challenge. They have to learn how to orient images properly, how to detect caries, how to collect a lot of information that gets incorporated into a patient's treatment plan. And so through our work with universities, and of course had the opportunity to start originally with the University of Florida, we've been working with them for about 2 years now. And they did a really nice pilot study and just looked at the effectiveness of students using the technology to accurately detect dental caries. And they found that the students had more accurate, their accuracy of caries detection improved by 40% with the aid of the technology. So in some ways, it helps train your eyes to find carious lesions, visualize them, create that mental image of so that you know what you're looking for in x-rays. And it seemed to really help students in that process. I'd also say the dental schools are, they're in the care delivery business too. And so there's millions of patients who receive their dental care in dental schools. And so just like there's a lot of opportunity for improved patient communication and efficiency and precision and detection of clinical findings that happen in the private practice, the same thing is important in the university setting. And so our schools are just starting to use Overjet in their clinical practices and for other things like, calibrating faculty so that everybody is standardized and calibrated in their assessment of patients, for example. So we've had a lot of fun working with universities. We've joined the ADEA Corporate Council. ADEA is the American Dental Education Association. We've used that as an opportunity to reach out to different schools and faculty. We provided more than 200 faculty development sessions just to help faculty deepen their understanding about the opportunities and potential use of AI in education. And I think that, there's still lots of opportunities to continue in that work. And I think it will really benefit, students, patients, faculty in the care delivery process.
Yeah, I think that's wonderful. I just graduated from University of Michigan back in May. So dental school is very fresh in my mind and the learning process. So I love those topics you hit on for students learning how to diagnose, but the calibration of faculty is really something that a lot of dental students complain about as pain points, that they could work with someone one day, create the treatment plan, come in the next time to do the appointment, and the new faculty says, oh, no, it's this instead, which obviously could still happen, but having that AI element to kind of, as you said, like standardize things a little bit more would be really interesting and something I wish we had at my school.
Well, that's great to hear because, I'm curious from your perspective. It's been a long time since I learned how to read a dental x-ray. And so I'd love to hear your perspective. Do you think having a technology that colorizes and identifies caries would help you in your, even in that learning process of how to interpret an x-ray?
Completely. Yeah. In the learning process, obviously you see several examples and maybe they do colorize them for you, but to the scale of having it done for you with hundreds and hundreds of patient cases, that's when the learning really starts. It's seeing it one time, kind of understanding it, but it's the repetition and variation of actual scans that would, I think, really help it sink in. So, that's what I was so interested with the dental schools. I feel like they should all have it eventually, hopefully. And I would imagine over the years, it will become kind of standard for the dental schools to utilize AI as assistants to learning.
Absolutely. And I would say dental schools are also very interested in kind of this academic scholarship and, either evaluating how it impacts student learning or improves patient care. And so we've actually been working with several schools on different research projects, either using our AI measures as clinical outputs in different clinical studies or assessing student learning, just as two examples. So in addition, I just think there's so many great ways that we can collaborate with universities, and it's been really fulfilling to have that opportunity.
And I'm interested, looking back over your career, you've been involved in education and then dental technology in many different ways. Is there anything that you think is just really interesting when it comes to how dental technology has evolved throughout your career?
Yeah, I think about that, and this will date me, this example. But when I was a dental student, composite restorations were just becoming popular, and we used adaptic technology, which was like first generation composite materials. And I think about how many generations of composites have been developed since then, just as a simple technology. And now, I mean, you think about diagnostics, about implant planning and digital workflows, CBCT technology, airway assessment. There's just so many ways that technology can be used to, one, advance patient care, but also to automate some of the kind of repetitive day-to-day administrative tasks that need to be done as part of a practice that consume a lot of time. Can we automate that in a way that enables clinical team members to have more time face-to-face with their patients? And then we already talked a lot about patient engagement and communication. So I just see that there's this whole world opening up of technology that can be applied in a lot of different ways to improve all aspects of care. And I'll also say that I'm a public health dentist by training, and there's a lot of people in our country that just don't receive dental care. And so I'm hoping that the use of technology will also make dental care more accessible to people, or maybe deepen their understanding of the importance of oral health to overall health and well-being. So I think there's just lots of opportunities to embrace and incorporate technology to really advance oral health in our country.
And I can really feel your mission and your values coming through about that. And a lot of my audience is new dentists and maybe even some students that are still in dental school. So I love to give my guests just a chance to speak to those people directly if you have any advice as they're beginning to navigate their careers.
Well, thanks for that opportunity. And I would say, as a former dean and educator, we would always teach our students, I'm sure you learned this at University of Michigan too, that your dental education is just the beginning, right? And so always be a critical thinker and a lifelong learner. And if, we talked a little bit about technology and how it's changed even in composite restorative materials. I mean, in my 40 years as a dentist, what I learned 40 years ago, some of those fundamental principles still apply, but there's so much more available to dentists and to dentistry and to patients today that you have to always be open-minded and willing, but also a critical thinker and make those assessments. Will this really advance my practice? Will it really benefit my patient? Is this something I should adopt? It's ready for adoption today, or what would I like to know that I don't know yet that would convince me that it's ready? So I would say that's just fundamentally really important for all technologies, whether it's AI and computer vision technologies or anything that you're ready to adopt in your practice. But because AI is becoming, so ingrained in our day-to-day life, I would just say understanding AI concepts, machine learning, and its various applications, not just in healthcare, but in our daily lives. I think that's something that we probably all need to know at this point, just so that we could be those critical thinkers and evaluate, the good and the bad, or maybe things we might want to be a little concerned about. And then I guess my last piece of advice is to really know your North Star. And, as a clinician, it's, how we should be asking ourselves every day, how can I provide the best possible care for my patient? And how will these technologies or innovations help me do that? And so as long as you use that as your guide or your North Star, I think that will really help us in learning about technology and also how to apply it effectively in our practices.
Thank you for that, and the encouragement at the end there to help people be recentered and always be thinking through their decisions is extremely important as clinicians. And thank you again for everything you shared with us this week. If people are interested in learning more about Overjet, should they just head over to the website, or what's the best way to maybe see how the programming works?
Yeah, I would say I invite everyone to come to our website. There's a nice button there where you can click and request a demo. We'd be more than happy to get one of our team members and provide a demo for you. We have great videos on YouTube as well. Those are some quick ideas, but we really invite you to take a deep dive, overjet.ai or overjet.com. We'll take you to our website. And explore what we have to offer. And if you're really excited, request a demo.
Thank you so much for your time today.
All right. It's been a pleasure. Great to meet you.